clinical photograph is an invaluable tool in the learning process of any medical practitioner. Photography can document the progress of a disease or response to treatment over time. Photography is useful to the clinician in several ways, such as teaching, public presentations, publications, preoperative planning, outcome evaluation, diagnosis, patient communication and patient satisfaction, and also in medico-legal and insurance-related issues. Not only is it important to click photographs, but also to do it the right way. This video will discuss the basic techniques of digital photography in ophthalmic and facial plastic surgery, standardization of photography techniques, and a few tips on how to convert your examination room into a mini studio. Some of the equipment you'll need before you start: a camera, a flash, a tripod or a monopod, a measuring scale, a memory card, and a basic photo editing software. Essentially, cameras are either single lens reflex or SLR, or point and shoot or compact digital cameras. Different lenses can be used with an SLR camera, which also allows the photographer to modify parameters such as shutter speed and aperture, and this enables the photographer to take photographs under all conditions. An SLR camera can shoot very high quality images, but it is bulky and heavy, whereas a point and shoot camera is compact, light and portable. The flash. The use of a flash is to illuminate a dark object to be photographed. Most cameras have built-in flashes that can be turned off. SLR cameras can have additional flash fixtures which can be used to create diffuse illumination. A flash may also be provided by external soft boxes which throw diffuse light on the subject and help retain all the subtle facial features. A ring flash is a circular flash that fits around the lens. It provides illumination and softens shadows even in cavities such as the mouth. A ring flash is very useful in oral photography when mucous membrane has to be harvested. Patient position. Most external photographs show the anatomical position as framed with reference to the adjoining features, unless the object of interest is hidden from view. Patient preparation. Whenever the face is photographed, the scalp hair should be brushed away from the face and tucked behind the ears. Jewelry, glasses and hearing aids should be removed. Face makeup is best avoided, especially in cases of skin resurfacing procedures. Background. The background should be an even, neutral, non-reflective, monochromatic surface. The preferred colors are white, grey and blue. White or blue panels on the walls or the back of doors may be adapted in the location where photography is planned, for example in the clinic. A light colored drape may also be fixed behind the patient while clicking a photograph. Common views essential to ophthalmology. The frontal view extends from the upper limit of the head to the jugular incisure, with the patient looking straight at the camera. The Frankfurt plane, the plane passing through the inferior orbital margin and the upper margin of the external auditory meatus, serves as a reference point for the frontal view. This plane must be horizontal. The oblique view. To obtain the oblique view, rotate the patient 45 degrees from the frontal view to align the tip of the nose with the cheek outline, taking care to leave a narrow strip of the cheek to differentiate the nose from the background. Now, the Frankfurt plane is horizontal and the patient is looking ahead. But remember, the subject's entire body must be rotated 45 degrees. Lateral view. To obtain the lateral view, rotate the patient's entire body 90 degrees from the frontal view to align the nasal tip and the chin. The head must be in its anatomical position with no lateral inclination, flexion or extension of the neck. The contralateral eyebrow must not be visible. The patient looks ahead and the images are taken, asking the patient to assume a neutral face expression, holding a relaxed and natural head position. Photographs of both eyes are then taken together and each eye separately, and this completes the entire set of basic photographs. Special conditions. Ptosis. In case of ptosis, it is important to document any face turn or head tilt before taking photographs of the face in its anatomical position. Two separate photographs are shot with both eyes looking straight, first with frontalis overaction, followed by one without frontalis overaction. This is followed by taking a shot of the subject looking down to document any preoperative lid lag. Finally, a photograph is taken with the eyes closed. Special care must be taken to document any Marcus gun jaw winking phenomenon. Motility photographs. To document ocular motility, external photographs of both eyes are taken with the patient looking once in each of the directions of gaze. A soft toy or a doll may be used to grab a child's attention while clicking these photographs. Usually, a collage is made from the photographs and combined into a single photo in order to present the abnormality. Proptosis and enophthalmos. In proptosis or enophthalmos, the basal view or the worm's eye view is taken with the head bent backwards to align the nasal tip with the eyebrows on a horizontal plane. The focus should be the cornea and not the brow or the chin. In the cephalic view or the bird's eye view, the photograph is taken from above with the eyebrows aligned horizontally. The patient should be looking straight. Macro photography. Use of a macro lens allows high magnification photographs of small facial lesions and pathology specimens. Look for a macro lens with a 1:1 object to film reproduction ratio to get life-size photographs. Here are a few other conditions which require specific photographs: entropion, ectropion, the punctum, rhinoplasty patients, and rhytidectomy. Intraoperative photography and videography. To obtain the correct exposure in intraoperative photography, one should try a different combination of overhead lamps inside the operation theatre with a flash being used and also without the use of a flash. Unlike microscopic surgery, recording oculoplastic procedures may not be easy. The photographer may have to stand atop a high mount to get good quality images without disturbing the surgeon. Also, intraoperative video recording of the surgery can be done with the help of a modified microscope stand on which a video camera has been mounted. Radiographic images. High quality images of CT scans or MRI images can be photographed after placing the radiographic films on a film viewer table with the camera flash in the off mode to avoid reflections. The camera should be held steady to avoid blur. Also, when sending the photographs for publication, it is best to remove from the photograph all the patient-related information as also other irrelevant data. To maximize the visual impact of the before and after pictures, one must ensure that the only variable that is now different in the two sets of photographs must be the surgical outcome. Even small variations cause drastic changes in the photograph's clinical relevance. Therefore, all variables such as the camera, the lens, the parameters, the lighting, the magnification and the patient position must remain exactly the same. We have seen that a simple and systematic approach to clinical photography ensures optimal photographic results. By using appropriate photographic equipment and the techniques, one is assured of obtaining standardized views for specific procedures in ophthalmology. Now it is time for you to shoot away.